Myself, Dr. JIBRAN Ahmad presents to you Simply Pathology, and today we are back with a very interesting session. So from today, we are going to start our preparation of NEET Superspeciality and INI Superspeciality examination. Now, this series is not only going to help the students who are sitting for the Superspeciality exams, but also those students who want to appear for FRC Path or any foreign board exam. Okay. And along with that, this is also applicable for those MBBS students who are sitting according to the next pattern of examination. Having said that, this is very useful for those preparing for USMLE exam as well as who are sitting for different board examinations of pathology as well in different countries like America or in Saudi Arabia or in the Middle East or any part of the world like South Africa as well. So what is very important, today we are starting off the discussion video on general pathology. Okay, so we are first going to start with the general pathology, and in the general pathology today we are going to start the discussion on cell injury. So today I am going to discuss 40 very important conceptually different MCQs, okay, which are very commonly asked in the exams, and those MCQs will be discussed in details which has a controversy surrounding them. Okay, so I will clear out the controversy that is there. Along with the 40 MCQs that we have in our website, we are also introducing the test series on the NEET Superspeciality or INI Superspeciality, wherein you are having more than 100 MCQs per topic. But these MCQs, they are not repeating, they are conceptually different MCQs, and they also have very good explanation as well. So we are going to start today's topic of discussion, cell injury MCQs. Okay, now one thing before I start off, okay, with the MCQ discussion, let me tell you very important stuff to you people. Okay, already I have discussed with you, okay, in my video on NEET Superspeciality how the exam is going to be conducted, what is the marking system, everything has been discussed in detail. Today I am going to tell you, before I start off with my MCQ discussion, I am going to give you some very important points regarding solving MCQs in the exam and how you should go about that. Now you have to keep something in your mind, that remember that one-liners or direct questions are constituting less than 10% of questions that are asked in the exam. Remember this point. Majority, more than 90% of the questions are indirect questions which are based on clinical scenarios or clinical vignettes, and such questions have become more important. Remember, whatever questions are asked to you, even if the question is easy, they are changing the options or the choices, and therefore they are making the solving of easy questions also a little bit tricky and difficult. Okay, so we are going to see that how we have to, how we have to solve such MCQs in a short span of time. Now with the digital period or with the digital era, the amount of image based questions is on the rise. So you are going to see that a considerable, nearly 30 to 40% questions that are going to be discussed today will be image based. Okay. Now remember one thing, whenever you are solving any kind of MCQs from any book, do not solve or repeat similar MCQs. For example, there is a question on apoptosis which is dealing on pro-apoptotic and anti-apoptotic factors. Now for example, there are 10 to 12 MCQs which are based on pro-apoptotic, anti-apoptotic factors. Now basically 10 to 12 MCQs you can solve on that, but conceptually this is regarded as one MCQ, that the concept is pro-apoptotic, anti-apoptotic factors. That's it. So that is one concept. So that is why we have introduced this concept, okay, that we are solving only concepts, not the number of MCQs. So it is the number of conceptual MCQs that matters rather than the number of MCQs that you are solving. So in any day, if you are solving 50 to 60 concepts, okay, you are in the right track. Okay, and solving 50 to 60 concepts one day is not going to take more than 2 to 3 hours. So if you are working, okay, in any college, if you are in your PG program as well, okay, so in that time you don't need to spend this much amount of time, but 2 to 3 hours over a week, over a 1 week period is enough for those who are in your PG program, and 2 to 3 hours per day for those who are passed out and who are preparing, okay, for the exams. Okay, now very importantly, how you should go about, you have to read my general pathology notes or see the general pathology videos in details. 90% of the questions will be solved just by looking at them or just by reading and going through the videos. Okay, we'll solve 90% of the questions. Okay, now the remaining 10%, some new additions, some updates that come, they are covered with the help of the test series. Now the test series and this MCQs and these videos, they are going to help you in applying the knowledge. So you have the details, you have the knowledge, but the application part is taught in the test series part and in the videos like this one that we are making today. Okay, so this is very important. So videos on the case discussions are also available and test series are also available in the Simply Pathology app or in the website simplypathology.com. You have to select the postgraduate MD DNB program. Okay, and lastly, you have to understand time management. So you don't have whole day. So time management is also very important. So if you can solve all the MCQs, okay, but you don't have time, again, that is of no use. So we are going to see all these aspects today and we are going to solve 40 very important MCQs today on the topic of cell injury. So let us begin today's topic of question, that is the question number 1. Okay. So 80-year-old woman with Alzheimer's disease dies of congestive heart failure. The brain at autopsy is shown in the image. The patient's brain exemplifies which of the following response to chronic injury? So very important, when the heart is failing, so the heart cannot pump, so it is going to lead to ischemia. So which is the organ that we are looking over here? It is the brain. And what is it that we are looking at? What is it that you are looking at? Can you see the widened sulci and the narrowed gyri in the frontal area? Yes. So basically what is happening over here? There is atrophy is what is taking place because of long standing ischemia that is there. Okay, because of long standing chronic injury. So what is the correct option out of dysplasia, hyperplasia, anaplasia, atrophy? So atrophy will be the answer. The correct answer is atrophy. So if you look at the explanation, atrophy may be thought of as an adaptive response to stress in which the cell shuts down its differentiated functions. Reduction in the size of an organ may reflect reversible cell atrophy or may be caused by irreversible loss of cells. Atrophy of the brain in this patient with Alzheimer's disease is secondary to extensive cell death and the size of the organ cannot be restored. So remember, atrophy, one another MCQ I am telling you, one another concept. Atrophy is the only kind of adaptation which can be reversible as well as irreversible. Okay, remember, atrophy is a kind of an adaptation and by definition adaptations are reversible, but atrophy is the only kind of adaptation which at times can become irreversible as well. Okay, another MCQ solved over here. Okay, so this patient's brain is showing marked atrophy of the frontal lobe. The gyri is thinned and the sulci is widened. So the diagnosis is that of atrophy, as we can appreciate over here. Okay, now the next question, let us solve the next important question, the question number 2. So the non-pregnant uterus of a 22-year-old woman measures 8 by 4 by 3. The woman becomes pregnant and just before delivery of a term infant, the uterus is measuring 38 by 20 by 12 centimeter. Which of the following cellular process has contributed most to the increase in uterine size? So you have seen, this is the case of pregnancy, the uterus has increased in size. In Robbins, I have read this under physiological hypertrophy. So the answer will be hypertrophy. Yes, you are very confident about that and you become very happy when you read the question, but when you come to the MCQs, you think what will be the answer? There are two options which are showing hypertrophy. What should be the answer? How I should go about that? So now again, see, this is how they are changing the MCQs. This is how they are changing the options, and here you have to be very smart so the basics will work. So if you read very thoroughly in Robbins, they have spoken about the hypertrophy of the smooth muscles, of the myometrial smooth muscles mainly. Okay, so endometrial stromal hypertrophy, myometrial smooth muscle hypertrophy, endometrial glandular hyperplasia, or myometrial fibroblast proliferation. So these two options cannot be. Okay, so what is the only, because hypertrophy, these two A and B can be there. So the most and the best answer is the myometrial smooth muscle hypertrophy. Why? Because the endometrial stroma, they are not constituting a major component of the uterus. Okay, so it is mainly via the myometrial smooth muscle hypertrophy which is going to be your answer. So this is very, very important for you to understand. Again, I'm not going into the explanation. I have already explained to you. Okay, coming to the third important question over here. Okay, after the birth of her first child, 19-year-old woman breastfed the infant for about 1 year. Which of the following process that occurred in the breast during pregnancy allowed her to breastfeed the infant? Now there are so many options. So if you see over here, basically there are many options given. Whether it was stromal hypertrophy, or it was lobular hyperplasia, or it was dysplasia, or intracellular accumulation of fat, or ductal epithelial metaplasia. Okay, so very importantly over here, if you see breastfeeding a child, first of all it is a physiological thing, right? So dysplasia is out from here. Okay, again intracellular accumulation is taking place out of many things. It is not an adaptation. Again, this is also out from the option. Now basically we have stromal hypertrophy, lobular hyperplasia and ductal epithelial metaplasia. So very important thing over here that you have to know, it is not the stromal hypertrophy, because it is the lobules which are actually, they are creating the milk and it is going. So it is basically increasing the number of lobules, and the correct answer will be lobular hyperplasia. This will be your answer. So lobules, they increase under the hormonal influence, mainly progesterone, to provide for normal lactation. The breast trauma plays no role in lactation and may increase with pathological processes. Remember, they are not having a role in lactation. Okay, the epithelial dysplasia denotes disordered growth and maturation of epithelial cells. So again, that is not an correct option. Accumulation of fat within cells is the common manifestation of sublethal cell injury, or uncommonly of inborn errors of fat metabolism, but that is not the issue over here. Epithelial metaplasia in the breast, it is a pathological process. Again, we are talking about physiology over here. Okay, so lobular hyperplasia will be the correct answer over here. Coming to the next important question, the question number 4. A 5-year-old boy suffers blunt trauma to the leg in an automobile accident. 6 months later, the bone trabeculae have formed within the striated skeletal muscle. So what has happened over here, there was one kind of tissue 1, and over here the tissue 1 has changed to tissue number 2. That is, from the muscle you have got the bone, bony trabeculae. But remember, the parent tissue is a mesenchymal tissue. It is remaining the same. The tissue number 1 is also a mesenchymal tissue. Tissue number 2 is also the mesenchymal tissue. So what is it that we are talking about over here? We are talking about metaplasia. One tissue type to another tissue type, but the parent tissue type remaining the same. So this pathological condition is an example of which of the following morphological adaptation of injury. So very important, what is the condition that we are talking about? We are talking about myositis ossificans. Okay. So why have I introduced this particular MCQ and not others? Because most of the time you are coming across the MCQs of epithelial metaplasia. Okay, so you are seeing like the Barrett's esophagus, okay, or that is the intestinal metaplasia of Barrett's you are seeing, or you are also looking at the squamous metaplasia in the respiratory tract. So these questions are very commonly asked, but if they are asking you a question on this, you are not being able to answer. So this is also one type of metaplasia, and it is very clearly given in Robbins. Okay. So this is the condition of myositis ossificans, and it is a condition where metaplasia is involving the mesenchymal tissue. Okay, so we have read about epithelial metaplasia, but over here we are discussing about the examples of mesenchymal tissue metaplasia. So this is an example of a metaplasia. Okay, okay. Again, I have given you all the details of the explanation, so I am not reading again. Okay. Question number 5. Let us see, the risk of endometrial carcinoma is increased by. Now, I am sure 90% of you will give the answer as hyperplasia, but this is the wrong option. So why? Because if you see the endometrial carcinoma, if you read in Robbins, there are two types, 1 and 2. So one of them is caused by hyperplasia, another one is associated with endometrial atrophy as well. So the answer over here, the risk of endometrial carcinoma is increased by both the above, hyperplasia as well as atrophy. Again, a very tricky question which is asked in the exam. Question number 6. Which of the following cellular adaptation may be irreversible? So I have already spoken over here that when atrophy is occurring secondary to the cell death, okay, in that case it becomes irreversible, as we have already seen. So atrophy is the only kind of cellular adaptation which can become irreversible at times, okay, which is an exception to the rule of adaptation. I already discussed with you. Next important question, question number 7. Both hyperplasia and hypertrophy is seen in which? So first of all, let us rule out. In the skeletal muscle, no, only hypertrophy. Cardiac muscle, no hyperplasia, there is hypertrophy only. Now there are two options in hand. pregnant uterus as well as the breast during puberty. So we have read about the pregnant uterus. Mostly and mainly there is hypertrophy. Physiological hypertrophy is taking place by increased in the synthesis of contractile muscle proteins, whereas in the breast during puberty as well as during the pregnancy period, there is both hyperplasia plus hypertrophy. So there is hyperplasia plus there is hypertrophy. So this is the correct answer. Many of you people are making a very, you are making a mistake in this particular option. So that is why this becomes a conceptually different MCQ. Okay, so remember these MCQs. One of the questions in this particular NEET super specialty exam 100% will be asked. Okay, so pay a lot of attention. Question number 8. Both, okay, so we have already discussed this. Okay, it is taking the best during puberty. So the question number 9, if we see a 34-year-old woman presenting with a 2-month history of fatigue, mild fever and erythematous scaling rash. She also notes joint pain and swelling primarily involving the small bones of her fingers. Physical examination reveals erythematous plaques with adherent silvery scales that induce punctate bleeding points when removed. Biopsy of the lesional scale reveals markedly increased thickness of the epidermis as we are seeing over here. So what is the condition that we are dealing with? As you can see, it is psoriasis. Okay. So which of the following term best describes this adaptation to chronic injury? So we are reading about injury. We are seeing the MCQs based on adaptation. So what do you think has happened over here? There is increase in number of cells. So there is hyperplasia as we can appreciate over here, right? So the answer is hyperplasia. So psoriasis is a disease of the dermis and epidermis that is characterized by persistent epidermal hyperplasia. It is a chronic, frequently familial disorder that features large erythematous scaly plaques commonly in the dorsal extensor cutaneous surface. There is evidence to suggest that deregulation of epidermal proliferation and an abnormality in the microcirculation of the dermis are responsible for the development of psoriatic lesions. Abnormal proliferation of keratinocytes is thought to be related to defective epidermal cell surface receptors and altered intracellular signaling. The other choices, they do not describe increased number of otherwise normal epidermal cells as we can appreciate over here. Now this is a histological picture and this is the question. Sometimes they might give you a gross image of an erythematous scaling rash with the same question. So the answer, the question is that of an adaptation and the answer is hyperplasia. Okay. Next important question, that is a question number 10. A 63-year-old man has had difficulty with urination, including hesitancy and frequency for the past 5 years. So a digital rectal examination reveals that the prostate gland is palpably enlarged to about twice the normal size. A transurethral resection of the prostate is performed and the microscopic examination of the prostate chips obtained is that of nodules of glands with intervening stroma. So which of the following pathological process has most likely occurred in the patient, in the prostate? So the answer is BPH, but even this is not the full answer. You should know the full form of this H, whether this H is hyperplasia or hypertrophy. So what is it? Please write in the comment section. It is benign prostatic hyperplasia. 1000 times this MCQ is asked. And remember, previously they were using this term hypertrophy. That term technically is incorrect. Remember, there is increase in number of both the stroma as well as the gland. So there is basically hyperplasia over here. So the answer is hyperplasia. So nodular prostatic hyperplasia, also known as the BPH, is a common condition in older men that results from proliferation of the glands and the stroma. The prostate becomes more sensitive to androgenic stimulation with age. This is an example of pathologic hyperplasia. Dysplasia refers to disordered epithelial cell growth and maturation. So this is no dysplasia over here. Although BPH is often called benign prostatic hypertrophy, this is technically an incorrect term. It is the number of glands and stromal cells that is increased rather than the size of existing cells. Okay, so a change in the glandular epithelium to squamous epithelium would be an example of metaplasia. So again, this is not the answer. This is also incorrect. This is also incorrect. Okay, so always remember this question, very commonly asked in the exam. Now the question number 11. Okay, now we are going to see a 42-year-old man undergoes liver biopsy for evaluation of the grade and stage of his hepatitis C virus infection. The biopsy reveals swollen or ballooned hepatocytes. Okay, ballooned hepatocyte, you can see these are enlarged ballooned hepatocytes, as we can see some of them also undergoing necrosis. And moderate lobular inflammatory activity is seen. As you can see, there is a lobular inflammatory activity is there. Okay. Now, very important, what you can appreciate over here, the arrow identifies an acidophil, that is a Councilman body is seen. Okay, as you can appreciate, this is an acidophil, means eosinophilic or Councilman body is there. Okay. Which of the following cellular process best accounts for the presence of scattered eosinophilic bodies in this liver biopsy? Now remember one thing, liver is the organ whenever there is some kind of injury, over here in the form of an infection with Hep C virus. Remember, both necrosis and apoptosis can occur together in the liver as a part of the injury in the liver. Remember this point. Over here, what we can see is an eosinophilic shrunken body, that is the Councilman body. And this Councilman body is nothing but the apoptotic body, and it is indicative of apoptotic cell death. It is indicative of apoptotic cell death. So Councilman body or acidophil body, okay, and this is in response to some kind of injury, that is the hepatitis C virus infection. So the Councilman body or the acidophil body, it is indicative of apoptotic cell death. Remember this point very clearly. So apoptosis, it is a programmed pathway of cell death that is triggered by variety of extracellular and intracellular signals. It is often a self-defense mechanism destroying the cells that have been infected with pathogens or those in which the genomic alterations have occurred. After staining with H&E, apoptotic cells are visible under the light microscope as acidophil or Councilman bodies. These deeply eosinophilic structures represent membrane-bound cellular remnants that are extruded into the hepatic sinusoids. The other choices do not appear as acidophil bodies. Remember this point. And this is basically, this Councilman body is nothing but it is an apoptotic body. Okay, remember this point very clearly. Okay, so the answer is apoptotic cell death. So very important, associated with this, there are two other MCQs which I will discuss with you. So one is that you have seen Councilman body, which is apoptotic cell body. Okay, apoptotic bodies or apoptotic cell death. Similarly, the next question, if you see question number 12, a 62-year-old man is brought to the emergency room in a disoriented state. The physical examination reveals jaundice, splenomegaly, ascites. The serum levels of ALT, AST, alkaline phosphatase and bilirubin are all elevated. A liver biopsy demonstrates alcoholic hepatitis with Mallory bodies, okay, with Mallory's hyaline. Now over here you are having this alcoholic hepatitis, especially in case of alcoholic liver disease. That was the viral hepatitis. Over here in alcoholic hepatitis, you can see certain Mallory bodies, or we call it properly as Mallory's hyaline. Okay. So these are nothing but these are certain protein aggregates. These are protein aggregates. So these cytoplasmic structures are composed of interwoven bundles of which of the following proteins? So the answer will be, it is intermediate filaments. Okay, so in alcoholic liver disease, whatever hyaline like structure you see in the alcoholic in the hepatocyte, you can see deposition. Okay, these are that of intermediate filaments. I will show you in the next question with the help of a diagram. Okay, and these and the protein deposition, okay, they appear mainly as a hyaline structure, pinkish eosinophilic amorphous structures that we see. Okay, and they are composed of intermediate filaments. So over here the Mallory's hyaline or Mallory bodies, they are example of intracellular accumulation of proteins in the form of intermediate filaments. Okay, now I have already discussed in details about that, so you can read about that in details. So the next question, that is the question number 13, is the same, but it is in a different form. 50-year-old male with a prolonged history of alcohol. So whenever there's an alcoholic history, okay, and they are having alcoholic hepatitis, okay, the microscopic biopsy of the patient from the liver is revealing eosinophilic inclusions within the cytoplasm of hepatocytes, as we are seeing over here. Okay, in the cytoplasm we are seeing certain depositions, right? So what is the nature of these inclusions? So first of all, what are they talking about? They are talking about intracellular accumulation. Okay, and what are these called as? These are called alcoholic hyaline, or basically Mallory's hyaline, that is the old name. So these are Mallory's hyalines. Okay, and what is the nature? They are basically intermediate filaments. So if you read my lecture on intracellular accumulation, you will be able to answer this question with ease. Very commonly asked question. So what is the nature? So the nature is intermediate filament. Okay, it is called as what? It is called as Mallory's hyaline or alcohol's hyaline. What is the basic clinical scenario? Alcoholic hepatitis. Okay, so I hope these three questions are crystal clear to everyone. Okay, okay. Now we are going to question number 14. Let us see the question number 14 over here. A 36-year-old woman experienced severe abdominal pain with hypotension and shock that led to her death within 36 hours after the onset of the pain. So from the gross appearance of the mesentery, which of the following events has most likely occurred? So what is this? This is actually fat necrosis. This is actually fat necrosis. Remember one thing, what happens that during, and what is the condition that we are talking about? It is a condition of acute pancreatitis. Okay, so whatever pancreatic enzymes they are released, they are leading to the breakdown of fat, which basically combines with the calcium and the salts and leading to saponification, leading to fat necrosis. Okay, so this is a condition associated with acute pancreatitis, and what is that is we are witnessing over here? It is fat necrosis. So if you see, the focal chalky white deposits are areas of fat necrosis resulting from the release of pancreatic lipase in the patients with acute pancreatitis. Viral hepatitis, remember, do not cause necrosis in other organs, and hepatocyte necrosis from viral infections occurs mainly by means of apoptosis that we have already seen. The viral hepatitis we had seen over there, the acidophil bodies. Okay, intestinal infarction is a form of coagulative necrosis. Again, we do not see this. Tuberculosis produces caseous necrosis. Gangrenous necrosis is mainly coagulative but occurs over an extensive area. Okay, so other options, again, they are not suiting to this. It is acute pancreatitis and it is fat necrosis. Okay, showing saponification. Question number 15, if you see, the pattern of DNA electrophoresis which is shown below is caused by the action of the following enzyme. So what is the pattern that we see over here? What is this pattern that we see? Yes, this is the classical step ladder pattern. Okay, step ladder pattern, and this step ladder pattern, it is seen in which form of cell death? It is seen in apoptosis. So in DNA electrophoresis, okay, you see basically step ladder pattern, and basically remember which enzyme is causing this? Yes, apoptosis is brought about by a group of enzymes called caspases. So they are the ones which are carrying out the process of apoptosis. But in the end stage, when the DNA is fragmenting and they are fragmented into particular sized based fragments, which is giving this step ladder pattern, that group is basically caused by DNases, okay, or a group of endonucleases. So when you look at this question, don't become excited. Please look at the options. Over here, if you look at the option, you have both endonuclease, transglutaminase, caspase and DNase. So the most appropriate answer over here is endonuclease, okay, which is breaking them into certain fragments, certain different kinds of fragments. Okay, so that is the process. For example, over here, if they say, okay, that what is the process which is taking place with apoptosis? Okay, another MCQ is if endonuclease and DNase, they are not there in the option, then the option will be, answer will become caspase. Okay. Okay, now question number 16, the same question over here about the given image, what is true? So if you see, this is, if I say this is A, this is B, this is C. So A is basically a normal. Okay, if you look at the B is basically depicting apoptosis and C is depicting necrosis. So B, so whatever you are seeing in the B, this is basically step ladder pattern of necrosis, that is apoptosis. And what is this C? This you can see a diffuse smudged pattern. We call it as smear pattern. We call it as a smear pattern. And this smear pattern is indicative of necrosis under this DNA electrophoresis that we carry out. So which option is correct? That C is showing necrosis. This is the correct option. This is again wrong. C is showing normal cell, no. A is showing apoptosis, no. Okay, so B is the one which is showing apoptosis, C is the one which is showing necrosis, and A is the normal cells. If you see over here, as you can see, this is the step ladder pattern, apoptosis and smear pattern, which is basically suggestive of necrosis and the agarose gel electrophoresis that we carry out. Question number 17, if you see, a 22-year-old construction worker sticks himself with a sharp rusty nail. Now within 24 hours, the wound has enlarged to become a 1 centimeter sore that drains thick purulent material. This skin would illustrate which of the following morphological types of necrosis. So what are we dealing with over here? We are dealing with an abscess. Okay, localized collection of pus, and that is in the form of liquefactive necrosis. Remember one point. Always you are thinking of that whether if it is taking place in the brain, then we call it as liquefactive necrosis. But abscess, which is very common clinical scenario, is a very common and example of a liquefactive necrosis. So remember this point very clearly. Now question number 18, a 17-year-old woman suddenly lost consciousness. On awaking 1 hour later, she could not speak or move her right arm or leg. Now 2 months later, a head CT scan showed a large cystic area. When the cystic area means there is some liquefaction which has taken place. So which of the following pathological process has most likely occurred in the brain? It is liquefactive necrosis. So the high lipid content of the CNS tissue results in liquefactive necrosis as a consequence of ischemic injury. Why we are calling ischemic injury? Because 70-year-old already she lost consciousness and basically she has a history of stroke in the past, and when stroke is happening, it is because of ischemia, right? And chronically because of ischemia, there is a necrosis which has taken place in the brain, and because in the brain there is a high amount of lipid content, so liquefactive necrosis is taking place. Okay. So this is very, very important. Fat necrosis, remember, most commonly it is seen in the pancreas, it can be seen in the mesenteries, it can be seen in the breast as well. Okay. Okay. Question number 19, if you see, fibrinoid necrosis is seen in all of the following except. Okay, so it is seen in malign hypertension, it is seen in polyarteritis nodosa, it is seen in rheumatoid heart disease. It is not seen in diabetic glomerulosclerosis. So the answer will be diabetic glomerulosclerosis. Question number 20. On the day 28 of her menstrual cycle, a 23-year-old woman experiences onset of menstrual bleeding that lasts for 6 days. She had regular cycles for many years. Which of the following process is most likely occurring in the endometrium just before the onset of bleeding? So it's a very, very common scenario faced by all women in her reproductive age period, right? So over here the menses is usually and mainly taking by a programmed manner, right? It is taking place every 28 days, and it is because of certain hormones are going up and then coming down, and because of that we are having regular menstrual cycle. So that is a programmed cycle. So the most important answer over here and the best answer is apoptosis. Okay. Okay, I am not going into the details again. The same details have been provided in our website in the app, so you can go and see the explanation over there. Question 21. Which marker is used to depict the following apoptotic cells? So what have we used over here? This apoptotic cell. Which marker have we used to highlight this? It is annexin 5 is the marker which have been used to highlight. So can you see what is happening now? Now as the days are going by, the competition is increasing. So none of the questions. So now they will not ask you which of the following are markers of the apoptotic cell and one of the option is annexin 5. No. They will give you an image. Then the options will be given. Okay, and then you have to choose or you have to write down the answer. Now question 22. Now even before reading, okay, if I see over here, what does it depict? It is depicting an apoptotic body. So visualization is very, very important. Now let us look at the question. A 22-year-old woman with leukemia undergoes bone marrow transplantation and receives a partially mismatched donor marrow. 1 month later, she has a scaling skin rash. Examination of skin biopsy specimen reveals the cellular change as we have seen. So it is an apoptosis process that is taking place. Now this change most likely results from which of the following biochemical reactions? Whether it is because of activation of lipase? No. Reduction of ATP synthesis? No. Because reduction of ATP will lead to the necrosis process. Lipid peroxidation, again it is a part of the free radical injury, that is necrosis. So activation of caspases is the most appropriate answer. It is a process of apoptosis. So once you look at this image, you know they are talking about apoptosis. You can straight away go for the answer of caspases, activation of caspases. Then question number 23. A 82-year-old man has profound bleeding from peptic ulcer and dies of hypovolemic shock. Okay, when there is hypovolemic means they are talking about ischemia. Okay, ischemia has taken place. Liver at autopsy displays centrilobular necrosis, or leading to necrosis is there. Now compared to viable hepatocytes, the necrotic cells contain higher intracellular concentration of which of the following? Remember one thing. Whenever there is cell injury, especially necrosis is taking place, always remember outside the cell, okay, till the cell membrane is well maintained, remember on the outer aspect, the concentration, if this is the cell, okay, remember on the outer aspect, the concentration of calcium is always higher, and it is 10,000 times higher as compared to the calcium which is present inside the cell. Even inside the cell cytoplasm, most of the calcium is sequestered in the endoplasmic reticulum or in the mitochondria. They are not present free in the cytoplasm. So once there is cell death by cell necrosis, remember one of the hallmark is there is basically breakdown of the plasma membrane, and once this plasma membrane breaks down, not only for the outer plasma membrane but also the plasma membrane of the organelles, they also break down. So what happens that calcium from outside they start to go inside, and from the organelles they also come inside, and as a result excessive amount of calcium increases during necrosis. Remember this point very carefully. And calcium itself, when it increases, is having deleterious effects inside of cells. That is a separate question, but over here, remember, over here the question is that of necrosis, and the question is with regards to integrity of this particular plasma membrane. All this copper, iron, selenium, their concentration are more inside, and after cell injury like this they go outside. Okay, so remember, compared to the viable means, they are compared to the normal hepatocyte or normal cell, the necrotic cells will always contain a higher concentration mainly of calcium, and this is one very important conceptual question which is asked in the exam. Okay. Next question, question number 24. Fibrinoid necrosis is seen